You had some more things you wanted to talk about.
Absolutely. So one of the things that you're seeing is, some people are looking at Governor Abbott and saying, what great leadership. He has a plan. He's got a 3-phase plan. Well, actually, it's a 4-phase plan. He only told you about the first 3.
Okay.
And he didn't make it up. It's already nationally done by the American Enterprise Institute. So you can look this up. Let's see if I can get that. And it's the main author on there was Scott Gottlieb. Scott Gottlieb of this American Enterprise Institute he was previously Food and Drug Administrator Commissioner. He serves on the board of Pfizer and Illumina. Wonderful. So that's who wrote our plan. This is the plan that your governor in whatever state you're in is following. And you're going to see that they all miraculously sound very similar to this.
Okay.
So I have a problem with this plan, and everyone really should download it and read it. It's not that long, and it has some scary stuff in it. And we were getting into a little bit about Governor Abbott's plan, and you can see where it came from in here. But this is actually the roadmap for navigating this pandemic. They have each phase where you can move backwards. You don't get to always just progress through.
Right.
And you're transitioning through. So in phase 1, we're trying to slow the spread. These are the things that you're used to.
Right.
Schools are closed. Workers have to do their work from home. Community gatherings closed. Restaurants limit their service until transmission is measurably slowed.
You said that the purpose of the plan was to slow the transmission. It was not to stop death, it was to slow the transmission.
And that's an important part. When you look at a bell-shaped curve, they were talking about this, I'm just going to use this as a bell-shaped curve. They were talking about flattening the curve so that it didn't go over, and people have seen this, the picture,
right,
where they said if we can flatten the curve, then we can not overwhelm the healthcare system.
Right.
Well, they didn't overwhelm the healthcare system. They never did. They never came close. And you understand an important part, and I'm sorry, but this gets into calculus, is the area under the curve, the total number.
Exactly.
There was no promise of decreasing the area under the curve.
Right.
There was still going to be the same number of people.
Right.
And there still will be the same number of people. And that's why they're talking about, if we do a really good job of sheltering in place and staying at home and quarantining and all the other nonsense, if we do a really good job and it really works, we're going to extend this. If these measures are successful, then they're detrimental.
Right.
Because now what are we going to do? Well, if there is a seasonal variation, as there are on a lot of cold viruses, during, they surge during cold and flu season, but they're, a bunch of low level year round, then what are we going to see? We are going to see, as Fauci has promised, we're going to see a little bit of a surge again. If we do keep this down to 15% of the population, you still have 85% at risk that don't have immunity.
Right.
We still got a lot more people, and it could potentially be even worse if we don't have all of these things. So what are they going to do? They're going to try and clamp down on it. Plus, the way that they are with numbers, they're going to blame influenza deaths and influenza, which is huge, and influenza illness on this, because it can't be too careful, and we're going to see a bigger shutdown. And that's part of the plan with this, phase 1, 2, 3.
Okay.
And phase 4 to be able to do it faster and better next time.
Yeah.
So it's not to decrease the area under the curve. The people that are going to get this are going to get this. Somewhere, depending on which study you look at, between 60 and 96% are going to be asymptomatic and not even know they had it.
Right.
The majority of the rest are going to have a cold.
Yeah.
The other people that were going to die, half of them were going to die that year anyway.
Yeah.
That year.
Yeah.
Because of their comorbidities. The other thing I was talking about with the National Coronavirus Response, written by Gottlieb, who previously worked for the FDA. So we were talking about phase 1, that was bad enough. Phase 2, then we need to isolate COVID-19 cases and their contacts. Now we're talking about contact tracing.
Okay.
Contact tracing means that you get diagnosed with it. It gets reported. Contact tracer finds out about it. They call you up. They say, who have you been in contact with in the last so many days? And you say, I've been in contact with her. She gets a call. You need to self-quarantine for the next 14 days. She's like, I just got back to work. They're like, we're going to call your work also, and you better not be there, or you're going to get a fine, or maybe we'll put you in jail. And then she gets off it in 14 days. and then I name her. She's back in the can again. And that could happen as many times as we want.
Wow.
What can she do? She can get the virus, get immunity, have the proof, and say, I'm not going back in quarantine again. Days. This is like when you played freeze tag, right?
Yeah.
How do you get base? Get the disease.
Yeah.
Nobody's saying that.
Yeah.
Now, if I said that, Texas Medical Board would be all over my case saying like it's criminal, it's unconscionable, this is honorable conduct.
Yeah.
But the truth is, and I'm going to get to that in phase 3, is actually what we need to do. So in phase 2, we're doing deep cleaning of shared spaces that should become more routine, more frequently sanitized. I heard one of the reporters asking Shelley, are you going to sterilize? I'm like, sterilize? That's like surgery. No, she's not going to sterilize it, she's going to sanitize it.
Yeah.
They're going to limit gatherings, wear fabric non-medical face masks while in the community. Fabric face masks have never been shown to be benefit. They were shown in the Spanish flu to not be effective, and they've never been shown to be effective since then. I have a thing that has the size of the holes. The virus in general is about 0.1 microns. Okay, we're talking about holes in masks, in cloth masks that are a lot bigger than 0.1 microns.
It's like
the only thing a cloth mask is stopping is your fingers.
Yeah.
So, from getting to your face. So if you have gloves on your hand, what is the difference between gloves and your hands when you're wearing them all day?
Yeah, exactly.
Zero difference.
Yeah.
Why are people wearing gloves? Why are people wearing masks in public when they're out walking their dog? Why are they wearing it in public when they're in their car alone?
So I'll tell you why, because I wanted to exercise my freedom of speech rights.
Well, the other thing is, open Texas. But the other thing is you see everybody wearing it wrong. You see it when it's below the nose. You see where it has big gaping holes.
Right,
A surgical mask, a cloth mask is worthless.
Yeah.
A surgical mask is to stop your cough and sneeze from going into the patient's wound.
Yeah.
You're still breathing air from these huge gaps.
Right.
Those masks are on the order of like 11% efficient. To best case scenario, 86% efficient of what's coming in this way. Now we have droplets. Droplets are defined as bigger than 5 microns. So you go like a meter, a millimeter, a micrometer. We're talking about small, 1,000th of a thousand.
I know.
So what are we looking at? We're looking at 5 microns for a droplet. If it's bigger, what's it going to do? It's going to have gravity bring it to the ground. That's where we say, like, hey, if I'm breathing, well, probably by 6 feet, it'll probably drop to the ground. If I sneeze, I can shoot across the room. If I cough. Now, an aerosol is less than 5 microns. Those just kind of float in gravity and just are out there. That's less than 5 microns. How big is a virus? 0.02 to 0.3 microns. Coronavirus, 0.1 microns. So even the N95 mask isn't stopping that.
Yeah.
An N95 mask is defined as stopping 95% of things that are smaller than 0.3 microns if it's tight-fitting, no mustache, no beard, and it's been fitted to you, and you're wearing it properly. You're not constantly adjusting it. Best case scenario, 95%. Of 0.3, how big is the virus? 0.1. So one of the problems is that the mask, and the N95 mask is really the only thing that's stopping the person wearing it from getting it. We know that the cloth mask is not for you, or a surgical mask too.
Right.
It's to stop your sneeze or cough.
Right.
So does my elbow.
Yeah.
So does me turning away from you.
Yeah.
Completely unnecessary, never been shown to be effective.
Yeah.
So, but it's a great thing because when the police look at you, they can see if you're a compliant citizen.
If you're, exactly.
Or if they need to beat you over the head.
Yeah.
So on to other readiness things. During phase 3, distancing restrictions can be lifted when safe and effective tools, including broad surveillance, therapeutics, or effective vaccine. So the vaccine's not going to be here. These medicines are going to be marginally effective, if effective at all. Probably most of them are going to have more side effects than benefit. But the broad surveillance will be in place to get out of phase 3. they're not getting out of phase 3 until they have surveillance down. So that was the executive summary, but there's a couple of other points I just wanted to touch on.
Does any of this stuff have to do with medicine, or is it all about control
None of
and
this,
surveillance?
Yes. None of this has any basis in science or medicine.
Okay.
Massively scaled contact tracing. Surge the existing public health workforce. Abbott said he wants to get up to 4,000 new people working in public health doing contact tracing. So they're going to have an army doing that. Rapid data entry.
And he's going to pay for them out of his own pocketbook too, or I mean, where's that coming from?
None of this is paid for.
Exactly.
No,
I mean,
the purpose of this is to just bankrupt the country as fast as we can. I mean, we're heading to $30 trillion deficit.
Yeah.
None of this is your taxpayer money. It was all just created.
Yeah.
This is the first $2 trillion is just a drop in the bucket. They're going up from there.
Yeah.
Phase 2, triggers for returning to phase 1, slow the spread. If it's not slow enough for them, who's them? These are some paranoid people.
Right.
Then who have another agenda. Then go back to phase 1.
It's certainly not doing anything based on science.
You know what? This is like the game of sorry. You're winning the game, and there's 4 people in the game, and you know the 3 people all have it in for you, and you were in first place. By the time it comes back to you, you're in last place. So that's what's going to be happening to you. Identify those who are immune through serology. Finally, you know, some sense, because the nasal test, first of all, it's done wrong. It's supposed to be the nasal pharynx. You see them like doing this thing into the nose, up this way. It's always done wrong. I know Dr. Fairless is saying you got to do it 2 or 3 times, the same test, and I told him it's because you're doing it wrong. You know, and I told them how to do it. But they don't look at how their techs do it. It's supposed to go like way back. So, therefore, no longer vulnerable to infection. So, if you can get serology showing you're no longer vulnerable to infection, you can return to work, including serving high-risk roles. If you read ahead to chapter 3, phase 3, on page 9, it's not a lot of reading, folks, get to serology showing you're no longer vulnerable. When I was young, they had chickenpox parties. Johnny's got chickenpox.
Yeah, I know that.
Go down and play with them.
I was going to ask you about that because, you know, when you found out that somebody had chickenpox, what do? You take your kids down.
Now we have a vaccine. And that's what they're going to criticize me for. We're going to have a vaccine. When? 18 months. In the meantime, we're going to shut the place down for 18 months, you know, going up and down and back and forth.
Yeah.
Serological surveys to determine population immunity. If a sufficiently high fraction of the population has become immune, either through natural recovery or vaccination, and the vaccination ain't coming, remaining restrictions can be lifted. Remaining restrictions can be lifted. You got a get out of jail free card, and the whole country has a get out of jail free card out of phase 3 if you can show immunity through serology. Phase 4 is do it better and faster next time. And you know next time is coming in December and January because they're going to blame the flu. They're going to say, well, how do we know it's not corona?
Right, right.
So the other guys on here, they have conflicts of interest also on this. And then they have the references throughout this, you know, are just, it's just an incestuous group that all write stuff for each other. And they have a vested interest in this. Where did that come from?